My name is Rune Andersson. I am a member of the reference group for Asia in the Union Church in Sweden, and I'm also a medical doctor, specialist in infectious diseases, and work as professor in global health. Now I have the opportunity to discuss with you the importance of attitudes for healthcare and also for other aspects of life, including relief work. My email address you can see on the screen if you want to contact me for further discussions. First, I would like to show you Mother Teresa's business card. I received it when I was visiting Calcutta and Mother Teresa together with a group of doctors in 1993. And I think that she has a secret on how a fruitful work is, and the basis for that. We can read, "The fruit of silence is prayer. The fruit of prayer is faith. The fruit of faith is love. The fruit of love is service. The fruit of service is peace. There is no good service without directed by love. That is in particular true for everything concerning healthcare. And if you think about what is your place in the world, what should you do? Think about the people you love. And after service in love, we will get peace." The opposite is described by St. Paul in the first letter to the Corinthians, chapter 13. "If I do everything but miss love, I am like a cymbal that is quite noisy and disturbing sound, not at all comforting and helping people." I will give you some examples. First, in disaster management. In December 2004, Southeast Asia was affected by the severe tsunami. Here are the Andaman and Nicobar Islands, and they were severely affected. And the islands, they were sunken, they decreased with up to 3 meters compared to the normal height of the islands, and they were moved 4 meters closer to India. Altogether in the whole Southeast Asia, more than 200,000 people were killed, and at the Andaman Islands between 5 and 10,000. I was there for the Swedish Mission Covenant Church to support the local church at the Andaman Islands in their relief work. And I arrived about 1 month after the tsunami, and it looks like this at the Little Andaman. That is, you can see what is the only remaining part of the church. These lowlands that were used for culturing rice were flooded by salt water. Every tide it was flooded and of course destroyed. Some years later, people started to fish on these areas, and that shows how people can adapt to a new situation. Dr. Christina Joyce went around in the villages with a mobile team, listening to the people. Many of them had severe experiences, lost family members, lost properties, and they had pain, headache, and she could listen, also put her hands on the painful part of the body, and they had also respiratory infections, diarrhea, and she had medicine for that. And by joining her for a week, I also noticed that the people appreciated that people also from countries far away cared, and that was very positive. The young boys were recovering first, and they started to fish with small pieces of net they found, and here are some crabs they were proudly showing me. First, people lived in tents like this. A little later, they got this temporary houses. It was quite noisy during raining, as you can understand, but they were dry even when the rain falls. And some years later, the more permanent houses were constructed at a more high level and was better than the houses they have lost. The Hindustan Covenant Church were continuing the work for 5 years until everything was finished. People got interested in more in the Christian church because of the relief work, and they also came to the church, and the congregation increased to about the double during these 4 years. Here is some members. At the sport arena, the children and mothers were evacuated from the Nicobar Islands. These islands were even more severely affected than the Andamans, and their fathers were participating in the reconstruction work. And when we met them, we think that they would have blamed God that could allow such a terrible thing to happen, but they didn't understand our question. They said, we know that this world is not a safe place, and God is our only trust and hope. And then they wanted to sing a song for us, and they sang this song about the stupid man that built building on the sand and the wise man building on the hill. And if you want, you can listen to their song at the YouTube if you type Nicobarerna. That made me talk a bit about the importance of having a good and basis on our life. And for us as Christians, what Jesus done on the cross in the salvation for all of us, that is the solid base we have for our life, and the solid cliff we can stand on. This painting was made by Chagall, the Jewish painter, at the age of 80 years. I found it at a gallery in San Francisco. I was at a conference and stayed at a hotel next to the gallery, and I went day by day and looking at this. And you can see a woman that is embracing Christ, taking him help, and several people help to take him down from the cross. And that is what we need to do, also embrace what Jesus has done for us. And around the cross we can see people in all ages, and in the right corner it is blue, and that is the color Chagall used when he was painting from his the village where he grew up in the current Belarus. And it has been said that he bought such a lot of blue color when he was living there that it was sold out at the shops. But that reminds us that everything is covered, also the very severe story we carry with us from our families, from the place we have grown up. When we now have our foot are standing on the ground, with what are we building? And we can read in the first letter to Corinth, chapter 3, the possibility to build with gold and or with grass. And in my interpretation, what the gold is what we do in love. Grass is what is done by other reasons. When we build as foreigners and are supporting work in other countries, I have read book by Pastor Marcus Cheng from China, written in the 1930s, and he said that foreign support should be like a construction framework we can lean towards, help us build our own church, our own structure, own organization, but they should not remain. When the building is finished, it's time to move that construction framework to some other place where it is in need of support. And that is a very good idea. From the Holy Trinity Cathedral or the Haile Selassie Church in Addis Ababa, this glass painting is seen where Moses comes down with the law from the mountain, and during the waiting time the people had made this golden calf. And this picture reminds me of an HIV positive patient I had some years ago. He says that all people are so much interested in the research funds, the money connected with HIV. It is like a golden calf people are dancing around, but not many cares of the calf, of the patients. And we need to really, in the work with HIV or all other diseases, care for the people we work with. We have sent many medical students for diploma and master thesis work in low and middle income countries. And many of them have heard the stories from the patients saying that stigma is much worse to live with than the medical problems. And we have also, like a student in Pune, India, that studied patients with Muslim belief, that many of the patients, they had a very good support for coping with HIV in their belief. But when asking with healthcare workers, they didn't discuss religion with the patients, and asking the imams in the mosque, they didn't think it was any HIV positive members coming to the mosque. So it was quite a lot of denial, and the full potential of supporting the HIV positive patients were not integrated in the care. In Sweden, we tried to have a team supporting the HIV patients with doctors, nurses, social workers, psychologists, but also pastors and diacones and imams, depending on the belief of the patient. HIV is one of the less infectious infections we have. It is only transmitted by unprotected sex, dirty needles, blood, and from mother to child during pregnancy, delivery, and breastfeeding, and no other ways. Not like the respiratory infections by air, not like diarrheal diseases by water and food. But people are not so well enough aware of this, and afraid of the HIV positive patients without any reason. One of the reasons why HIV has spread so rapidly in Africa is illustrated in this picture. During the first 1 to 2 months after getting HIV, the virus amount in the blood and also in the seminal fluid, vaginal secretions is very high. Then it goes down to a low level, and during that part, the risk every time having sex without condoms can be as low as 1 in 100 to 1 in 1,000. Then the risk increases again when the patient gets the symptoms of AIDS. But at that time, many are too sick to have many partners. The problem is here that very many in Africa, they have the family in one place and work on some other place, because the work is not organized in a way that they can take the family to the workplace. And too many have partners on both places. And if they go home to the home village once a month, the risk is very high to infect the wife.